thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Lisa McLaughlin, who is the co-founder and co-CEO of Workit Health, which is a platform that helps people through addiction. I love that Lisa, it was so important. She is a recovering addict herself. She got sober in 2002 and formed the company with somebody she met in the Bay Area a little bit after that. And so they really connected and then were inspired to start this company after a loss of one of their friends. And so Workit Health started in 2015. And so I love that this company is so focused on treating all addicts, no matter what type of recovery they need, because she was saying that the traditional models of, 12-step programs and other things like that, that they are successful, but only for a small population of the people. And the retention rate, even after 1 month, is incredibly low. Whereas they have an incredibly low barrier to entry to be part of Workit Health. She said addiction's a 24-hour cycle. And so whenever people are having that moment that they need help, they want to be there for it rather than having somebody wait for a meeting. And so people go through their system, mostly covered through insurance and a lot covered by Medicaid, which she finds to be one of her hugest successes. And they're able to just go in, put their insurance information, and then be connected to an NP or an MD and get on that care journey where they then meet with a care concierge who helps connect them with local resources, groups within the platform, all kinds of different things, and really follows them along that journey, tailoring it to the type of care that that person needs. It's so specific and personalized, which is so cool. I love how individualized it is, and it's making a true difference. She said that their retention rate after 1 month is 86%, whereas in the traditional models, it is 40% at 1 month. So mind-blowing work that they're doing. Apoorv, what stood out to you?
Thank you, Stephanie. I think what Lisa is doing is truly tremendous. To me, it's a example of what we mean by when we say making healthcare work for you. I think this is a phenomenal solution because the system is so disparate. It's siloed. You can go here for your addiction care, you can go here for your medicine, you can go here for your behavioral health, and then go here separately for your primary care. And what they're doing through their Workit model is connecting all of the dots and making it actually work for the patient. But as you said, in a very highly customized, individualized way, because they are themselves so have experienced the challenges of addiction and have therefore designed a model that is very patient focused, patient driven, patient centric. So it's remarkable, and yet they're doing it all using the standard insurance mechanisms. A lot of people are struggling making healthcare work because we wonder, who's going to pay for this? Where's the money going to come from? And here in this model, they're actually using insurance, Medicaid, which always people complain about, doesn't pay well enough and is leading to disjointed outcomes. Here, they're using the standard insurance products and making that available to people. So I find that story really remarkable, is that this should not be difficult for people to access when you can put the power of a company like Workit behind the scenes, curating the providers, figuring out who are the safe dentists to go to that may not be, that won't use medication overwhelmingly. So I think that they've done a great job of compiling this resource and then making it available to people in a way that actually leads to privacy, anonymity, and access. It's a remarkable company. I'm so glad to have learned about it, and I'm hoping our audience will have a chance to learn more about them as well.
Yes, absolutely. And you mentioned the ability to remain anonymous, and that was something that I also really liked. She said that there's a lot of gating in there. And so there's so many different ways that people can choose to be anonymous or decide to be as public as they want on that platform, but it's completely up to the individual, which gives them, people in, first responder situations or other types of places where they're caring for other people and might have an extra stigma to seeking treatment, really gives them the privacy that they need to get the care. And so like you said, it was a fascinating interview. They really are figuring out an incredible model to do it. We'll talk to you soon. Bye-bye.